All right. Hi, everybody. Dr. Shadi Ravich here, and a sad video, but necessary one. Tribute to Dr. Lahunta, Dr. D, uh, the greatest professor anyone could have ever had. And so I figured I would share some stories with this amazing, amazing gentleman, and say to his family, it's a huge, huge blow to the veterinary field and to future veterinarians who really need someone like him. So I had Dr. Delahunta when I first went to Cornell University, 2002, and taking, as everyone else did, his neurology classes. I was terrible at it, really bad, and his energy right off the bat was obvious. The guy basically is the father of neurology, and he would teach neurology, neuroanatomy, embryology, anatomy, just with such fervor, especially considering he's so experienced and been doing this for so long. He would teach the class as if he was learning it for the first time himself, just super excited every single time. So just unbelievable passion pouring out of this guy. And neurology in general is very intimidating for any student, any vet student. So he really would make you want to learn it unknowingly, I guess I would say. Because I would get distracted if I sat anywhere in the back of the class, I always sat in the front. That way I can stay focused, and anyone who knows who's gone through higher education, you're constantly sleep deprived. So I would sit in the front to make myself focus, to look at the slides that he's presenting, so I wouldn't fall asleep, and so I wouldn't let anything else distract me. And of course, it kept me accountable. If I did start falling asleep, which would happen on occasion, at least the teacher is right there and they'll kick you in the butt, which he, of course, was not shy about doing. So he would constantly call out my name whenever he asked the questions of the class. Constantly, Shadi, Shadi, Shadi. And he'd ask the question to the class, some neurology question, and look around as if he was going to ask anybody else, but always went right to me. Shadi, what is it? What is it? So it was a running joke in my class. Dr. D loved me, and he was always on my case. He wanted me to be good at neurology. Of course, he cared, and we just had a really nice connection, nice energy. So that would happen anytime I took any of his classes. He was also famously known for his 2 a.m. neurology rounds. These were cage side rounds usually. The story is, he used to have his neurology rounds during normal hours, evenings or something. But they became so popular that there were so many students that would attend his rounds, where he'd examine the patients that were in the hospital at the request of the primary clinician on that case, that he couldn't do his neurology exams anymore. It became too much. And so this is the story that I know, that I was told. He switched it to some obscene hour, so 2 a.m. He'd do his neurology consults. And those are the consults that the doctor in charge of the case would say, okay, this patient needs to see neurology, and they'd fill out a form and hand it in, and Dr. D would receive the form and then do his neurology consult, but at 2 a.m. So I would go to school all day, do my work afterwards, go to the gym, and then go home, sleep for a few hours. I'd wake up around 1:30, and I would just slump out of bed and get to the school. Doesn't matter if it was snowing and freezing and whatever. Get to school, get there by 2 a.m. and I was always there. And it was either me by myself, or there would be maybe a couple of other students there. Sometimes a resident would be there, and that's it. It was us for the next hour, looking at cases with him. So of course he's going to quiz the hell out of you, and he did, and you'd be able to take what you learned in class and apply it to a real life setting and watch the guy work. Just this masterpiece of a doctor work. And it would be small animal, large animal, doesn't matter. In fact, one time I remember him showing a video in class where he made a student at 2 a.m. hop a llama to test its postural reactions, test its proprioception. That was funny. Hopping a llama. I'm sure he would have done it himself if he could. So anyway, so we'd be there every single time for rounds, show up 2 in the morning and learn. I worked my butt off just to get a C in the class, a C. And now I'm a board certified surgeon. I perform neurosurgery all the time. So it's just really funny to get a C in that class. But there's a reason for that statement. Towards the end of school, I was looking for additional credits. I needed some additional credits. And I thought, well, why don't I ask if I can convert these 2 a.m. sessions to credits? And there's a research class that you can take that I guess you perform research, those hours would count towards credits. So I went to him and I said, hey doc, what do you think about this idea? He goes, sure, yeah. Fill out the form for the class, I'll approve it, and whatever. He goes ahead, he approves it. It was declined by the registrar. They said, nope, no can do. So I went to him, I said, man, I'm like, thanks for trying, doc. They declined it. He goes, what? Let me see that phone. Pick up the phone. He's like, what is going on? And he would like yell. Hang up the phone. He goes, you're approved. You're going to get the credits. I said, oh my God. That's how you know you're a G. That's how you know you're a G. So all those 2 a.m. courses, again, at the time that I would join him was just for my own interest so I can learn neurology because I sucked at it. And then it turned out I was able to convert those to credits later on, towards the end of my schooling. The reason why my C grade in neurology matters is because I had the audacity to ask him for a letter of recommendation. I needed to get into a general internship and then hopefully a surgical residency. You need letters of recommendation. What better name than the father of neurology to have write you a positive recommendation? So I went to him and I said, look, I know I got a C in your class. Can you write me a letter of recommendation? He goes, yeah, of course. He goes, the grade doesn't matter. What matters is your interest. You work hard, you're trying your best, you're going to do great things. I got you. I'm paraphrasing, of course. He never said, I got you. And then after graduation, I was actually emailing him fairly frequently, get his advice on stuff, either with cases or how to handle, a negative culture at a hospital, or a mentor that was just being a douche, and he'd give me advice, back and forth. And he not just shaped my personality and my ability to perform veterinary neurology, but he was a huge positive force for the veterinary culture, and unknowingly, at the time we don't know, you're getting destroyed just in vet school, and you're sleep deprived and doing all these classes, trying to get a good grade, trying to make friends, trying to do all the things that students do. And so he was just unbelievable. And so I look at his book and I see in the back he has these. I mean, these are archaic now, but you'd have these brain slides, and he would pull up MRIs and CTs on film, on clear film, and put them on a projector, on the overhead projector, which now obviously you'd use PowerPoint or something. And he would just go through all these slides and go through these MRIs and CAT scans and quizzing us. I mean, it was great. It was great. And he'd bring in just slides of just histopath and cytologies and whatever, and just that was the technology we had then. So anyway, that's my experience with Dr. D. It was absolutely amazing. The guy would run like 5 miles or 8 miles a day every day, and he owned 1 million dogs at home, and just truly a wonderful gentleman, an amazing professor, and just a great person. And I hope that those who were lucky enough to experience Dr. D can take those valuable lessons from him, apply it to your own life, and help this profession that is struggling and has been struggling for decades. So that's my tribute to Dr. D. Sir, absolute honor to have met you and to have been part of your life. And that's it.